afternoon, good night, good morning, good everywhere because we are in every different part of the world. Ladies and gentlemen, esteemed guests, fellow advocates, welcome to Global Mental Health Peer Network webinar. Today we're going to explore the voices of lived experience, empowering mental health advocacy through storytelling and research. So we've heard so much about storytelling and research that I think it's quite new that lived experience is able to be part of that. So we will dive through the topics for today, and we're going to break down and explore more about how narrative story able to drive meaningful change in mental health research and advocacy. So without further ado, I'm going to invite the first speakers for today is Parth Pharma, a dedicated advocate and clinical trauma professional, and he is certified in clinical trauma professional, specializing in gender-based violence, intimate part of violence, and childhood sexual abuse. And he also focused on health advocacy and youth engagement. So Path work extend beyond clinical practice. He is actively involved in academic research, advocating for health equity, policy reform, and so that is so incredible CV. He also has a lived experience, so he informed his person-centered right-based approach at TNF, India, Trauma Education and Research Foundations. Through this organization, he focused on trauma, human rights, and education. So he's also a champion in disability rights and mental health activism internationally and global advisor, also consultant. So for so many organizations. So without any further delay, please the place and the room is yours.
Thank you so much. Thank you so much, Anto. That was really sweet for the question. Do let me know if my screen is visible.
Yes, you are visible.
Oh, fantastic. Fantastic. Hi, everyone. Thank you so much for being here today. I'm very excited to be here and talk a little bit more about what lived experience informed research is and how can your experience as someone with lived experience of mental health, disability, of being on the margins of society, inform research and also improve the way that we understand research. I'm excited to be here. I'm a part of the Global Mental Health Peer Network. I've recently joined, and they've been very kind enough to give me the space today. So thank you so much for being here. For the longest time, when we're talking about lived experience, we would have all heard the words, nothing about us without us. It essentially stems from this space that we want to be participating in the work that is happening about us. But for the longest time, that was not the case. When we look at psychiatry and we look at how the mental health space has been, it has always been a place of coercion, of torture, of having people with mental health looked at someone with deficits in them, and that there is some treatment that needs to be provided for them or something that needs to be done for them. So there's always been this hierarchy in research that has been that us versus them, there are researchers and then there are people with mental health issues, and then people with psychiatric illnesses or mental health disorders that need to be studied, that need to be treated, that need to be cured of those said mental health conditions, right? Well, nothing about us without us goes beyond this slogan. It essentially calls for a social justice where we want inclusion in research because we are people with lived experience who have our rights, are informed about our rights, and want to be active participants. It also says that we are key stakeholders in the process of research. Gone are the days where someone with lived experience with depression, anxiety is going to fill in a questionnaire for someone and say, okay, that's it. I'm a participant. I've done my checklist on a form. Someone has asked me a couple of questions. I've narrated my life out to someone. I've talked about all the deepest, darkest things that I've gone through, and that's it. There's nothing after that, right? Well, lived experience informed research says otherwise. What it advocates for is being active participants over passive subjects and being key stakeholders in the research process from the conceptualization of the research till the dissemination of it as well. One of the most important things that even I've noticed as a service user has been that when someone has a title or someone has a degree, that makes them the expert. And then they'll come and tell you in the sessions in therapy or with psychiatric consultations or in healthcare systems that this is the biochemistry of your brain. This is how trauma has impacted your brain. This is where the depression comes from. This is where the anxiety is stored. So you pop this pill, go to this doctor, go to this therapist, and that's it. That medical model or biomedical model is long gone. Now we're looking at mental health through a very multi-sectoral lens, through a very intersectional lens, where we're recognizing that people with lived experience have their own expertise as well, and that they are coming in with their life experiences that need to be given that opportunity. They need to be given that same weightage that an expert by training brings in. And that essentially says that we're no longer discarding the fact that depression, anxiety, trauma have their effects on the brain, on the neurochemistry, but that's one very small portion of health in general. And that health can no longer be viewed in a silo of just physical health. We need to look at social political factors, social determinants of health, class, caste, race, ethnicity, gender, sexuality as markers of health as well. So when we say nothing about us without us, it quite literally means if I'm bringing in my lived experience, it's not just about my mental health. It's also about my class, my economic standpoint, which country am I based out of? What is the space there? My leanings, all my different identity markers are sort of combined together within that space. Within lived experience informed practice, this is a fantastic infographic by a researcher called Sunny Jane Weiss that I got here. It essentially talks about, you see this blue, one pie, which is light blue in color. Usually research would only be that. So that's 100% of the research is rooted in evidence-based literature, where researchers are coming in from a power hierarchy, and then there are studying others who need to be treated or cured. So there's a lot on focusing on pathology, which is essentially what's going on in someone. How do we make sure that this part of their life is pathologized? So, okay, this is the structural or functional deficit in your brain. This is the research is focused on that. For the longest period of time, most common mental health issues or severe mental health illnesses as well were focused on just that small blue pie, which considered researchers, their expertise, mental health professionals, their expertise, and that's it. And there was nothing more than that. But that time is slowly changing. And very glad that organizations like the Peer Network are doing that and facilitating that change. But today we're looking at more than just the evidence. We are saying that we're not only looking at the biomedical, but we're looking at an intersectional understanding of what research looks like. We're also looking at lived experience as the foundation of all research. That we're no longer saying that you can just have someone with lived experience as a token there, but we are saying, no, have us actively be a part of this entire space as well. So here again, one of the most important things to note is that we're not devaluing what research brings in or what people with expertise in research bring in. We're essentially saying, bridge the gap between the people that are being studied and instead take them as key stakeholders within that research as well. So it's very important to focus on the community, and lived experience informed practice does exactly that. It gives the focus to the person's lived experience as well. I remember something very interesting when I was a teenager, which was that a lot of research was being done within the space of India in the field of trauma. And a lot of researchers at my university had reached out because I had been very open about the fact that I'm a lived experience survivor of trauma, depression, anxiety as well, that let's do a study there. But the whole idea was to do a qualitative interview, to have me narrate my life, and then use snippets of that interview to inform case practices and best practices, right? So they did that with a couple of us. It was a qualitative research where we were 8 participants, and we spoke about our lived experience in great detail. But the way that the lived experience was used was in quotations when we were all made anonymous. Now, granted, that is how traditional research works, but lived experience informed practice would say, why are we tokenizing people with mental health issues? Why are we reducing them to a quote in a research paper? Why not get them on board? Why not get them to be part of community advisory boards? Why don't we get them to start at the foundation of the conceptualization of the research and say, from here onwards, you're a part of us. So we're not just going to use you as a quote at the end of the research to say, this is the best thing you can do with trauma, but instead we're going to say, come join us, work with us, and let your experience influence the way that we view trauma as well. There are 4 things that I think that I've noticed as a service user myself and that I've seen with my lived experience that helps quite a bit in research. The first is capacity building. Again, we're not assuming that people with lived experience don't have the tools to be able to do research or don't know how to do research. It's just that sometimes the research that has traditionally been taught to us may not be the same that is being done. So when you get lived experience researchers, experts by experience on your panel, on your research, you're essentially doing something called co-design, where you're having them be an active part of the entire process. And at the same time, you're also helping them get the skills that they require to facilitate this change, to be an active part of research. So here you can do trainings, workshops, again, this goes bi-directional. So it's not just the people with lived experience getting the trainings to be good researchers, but workshops that they are taking for sensitization of researchers on what is a trauma-informed way of talking to people, what are non-coercive practices in research, what is safeguarding of people with lived experience. So it's a bi-directional channel of capacity building that happens. One of the most important things that lived experience research does to just our idea, traditional idea of research is it moves away from the pathology-based research, that this is a deficit, we need to focus on that. Rather, it talks about recovery-oriented processes, where people with those lived experiences are now talking about what are the best ways that they can go back to their communities, they can stop being institutionalized, they can facilitate change, and they can feel that sense of empowerment within their own communities, instead of the isolation that hospital settings, institutions bring with them. Another thing which is so interesting is that for the longest time, there is a power hierarchy that has taken place, right? There is a doctor, there is a clinician, there is a therapist, and then they empower us in therapy. Researchers do research on us and empower us, where they don't have necessarily the lived experience, but they're always in the focus of empowerment. Lived experience informed research flips that narrative and says that we no longer want to be taken as passive viewers, but we want to be taken as people who can be empowered on our own. Another most important thing about lived experience is community-based participation. You view other people with lived experience and see that you're not alone in that process. So when you're on a community advisory board for research and there are 10 other people, it might be the similar lived experience of depression, anxiety, of bipolar disorder, but they're so different in the way that they view and it's affected their lives. It also influences trust. These community advisory boards are the best way to bridge the gap. So I would, sorry, just a second. Yeah. What I would say to close is that, we are all experts by experience because of the lived experience that we bring in. And that essentially matters. That matters in research, that matters in dissemination, and that matters in conceptualization. So if you're a person with lived experience, do join.
Yep.
Thank you so much.
Thank you, Parth. That was really amazing presentation, and you got right on the point of how these lived experience role in research. So, but we will keep the question. So anyone want to put the question out, please put on the chat box. So we will move on to the second speaker, which is now let me get it. Sorry, Fahmida, Akter Anki. Thank you for joining us now. I would like to read some of your CV, which is you are passionate mental advocate from Bangladesh. So you have some lived experience, and you become a mental health first aid support provider and launched Manoj Bangladesh. That's amazing. Focus on youth mental health with a background in health economics. You work at ICDDR and contribute to the Commonwealth Youth Network. And you recently spearheaded the mental health flagship initiative for youth at the World Health Assembly. That's amazing. So without further ado, you may start your presentation. Thank you.
Thank you so much. Thank you, everyone, and thanks for having me. And obviously, a big thanks go to Parth, because Parth have shared a lot of the important points of having this concept of lived experience, especially in mental health. Lived experience can be defined in or viewed in so many aspects. Anyone have any sort of experience, and that can bring change into contexts. And specifically in mental health, it's very, very far more important. Initially, it was in disability rights. Now it's, since we are changing the narratives, it's also we are understanding more in terms of mental health and other psychosocial barriers or concepts as well. So I'm not gonna take much time. Let me share my, it says that it's disabled. Can I share my screen? I mean, I can't share my PowerPoint presentation, if you could allow me.
Yes, you can now.
Yeah, sorry for that.
Okay, great.
I hope you can see the presentation.
Yes, we can see it clear.
So yeah, so my topic of the subject is that being a mental health lived experience advocate, how does it feel? And today I will share some personal reflections, how it all started from my end, and as well as how I learned, how I went on, and some learnings that I have gathered in all my years. And obviously, anyone who wants to be a lived experience advocate in future, so how can they get started, or how can they get the help and start? So I'll talk about it briefly. So already, as I said, Parth has already covered that what exactly lived experience concept, how it works in research. So similarly, can you see the presentation slide?
Yes.
If I'm not wrong. Okay, I think yeah, some technical issues. I'm really sorry for that. Anyway, so anyone who doesn't know what lived experience advocacy means, so by definition, we know that it basically we draw from our own experience, and by this we try to bring some changes. Then it's mostly related to psychosocial issues such as discrimination, mental health, disability, poverty, trauma, or any other marginalized identities. So we advocate for change, and what is necessary, we try to identify and bring it into the table that wasn't discussed for long. And in this approach, what we say, individuals share their firsthand experiences. And to raise awareness. So this brings awareness, and obviously brings awareness means it obviously challenges the stigma around that specific topic, or specifically mental health issues and other barriers that we face. And later it actually influences policy and obviously promotes that understanding and empathy. And this actually, that I personally say, there's a deep sense of justice, deep sense of belonging that that was ignored, and sense of having the right to live to our fullest potential, to being ourselves. So before I talk about my own reflection, I'd also like to say some other forms of advocacy in mental health that was already there, which is we have seen a lot of self-advocacy, peer advocacy was also there, individual or group advocacy was there, organizational advocacy was there, and obviously that hierarchy that mental health professionals, there are they basically work from medical model or biomedical model perspective, but now things are changing, so everything is actually quite integrated. So someone who is doing the self-advocacy can also do the advocacy through groups or with groups or peer groups. Our Global Mental Health Network is one of them. We are here, we're sharing our lived experience, as well as we are forming a group, learning and sharing our experiences and our services. And that's how we are doing the advocacy and taking to the next level, to the policy level even. And there also can be some specific crisis specific or even specific advocacy. Anyone can do so. So what I was saying, that how all these things can be done by one person in group or so many things all around. But why is lived experience so different from other advocacy? Like even before, like when I started, I never knew that my lived experience can be this much valued. Even when I was starting, I wanted to do something for myself and people I know around me. It didn't start knowing that I am doing all these things I'm doing is actually can be called advocacy. I was doing it unknowingly. I joined my local organizations, my community organizations, and I became a first aider. And it was just a self-discovery, a self-learning journey. But then I literally found myself as an advocate. Now, people told me that your information, your help helped us. We shared our experience and we found common ground. So usually being an advocate, it doesn't necessarily have to be, you have to be a go-getter, you have to join there and be an advocate, not like that. But sometimes even you even don't know how inspiring you can be just sharing your own experience. That's my very first a very authentic story of mine. Even for long, I didn't even consider myself, oh, okay, I'm an advocate, mental health advocate. But now that I do, now that I have gained experiences, now that I have worked so many peers and got all these perspectives, now I can see that how important it is. In Parth already shared that it's important in research, it's important in social change. So as I already shared that it actually, there's some sort of the justice that something that we felt we need to do, we need to establish for our well-being, and to be ourselves, to be our full potentials self. And that's one of the core focus of the lived experience that I believe. And it's obviously different because among all forms of advocacy, lived experience advocacy actually holds the most amount of vulnerability. It's something that it has a lot of concerns about privacy and concerns about protection. But it is possible. It is possible to do so when we are agreeing and creating safe space. So yes, so it is necessary for lived experience that we create the safe space and we provide the safe space, and our advocacy does also help to build this kind of safe space as well. So I would say from my experience, what I have seen, it is associated with vulnerability and it is associated with learning. I have learned so many things just by putting and having this intention to do something for myself and for others as well. So what can I do about it? What is it? What mental health is about? What are the narratives? Even some of the narratives I didn't even know until I studied it, until I talked to my peers, I talked to other people, and I have seen that how different people's experience can be. Same depression can manifest in differently in different people, and that's where the intersectionality comes, and it is actually like expanded through different aspects of life, be it an economic aspect, be it in political aspect, be it in their social hierarchy, whatever you call it. And then this is the point that all these experiences, it holds the authenticity, because authenticity means since it's vulnerability, and here comes the authenticity as well. So to be our authentic self, we need this sort of support. We need this sort of environment, and discussion where we can do this advocacy. And obviously, all through experience, you either learn to be learn to generate empathy for others. Also, most likely what I see, that all other advocates basically learn this empathy in lived experience. Basically, we are naturally, we since we have suffered or have experienced many different experiences, and so that actually creates a genuine empathy in ourselves. So it also creates a reliable network, reliable supportive environment for others when we interact each other. It provides a safe space. So, and that's how specifically this is how we build this peer support system for us and for others. And probably that time, I would say probably that is the time when personally I felt like, yes, now this is my journey, this is my story, and it's actually inspiring others, perhaps. And the whole process, it may seem linear at some time, that this and that, I will do this and that, that's how I will go. But it's not as linear as it sounds. And it is definitely has its pros and cons. But the whole learning process, whole journey, I want to say that none of us are alone. Help is there, our supports are there, and we are when we want something to do, we can achieve. So this belief, resilience, and the confidence, we must have it in it, and the support, the peer support system we can build can be a really good motivating factor for us to be a great advocate in this sector.
Yes.
So yeah, so the point, if anyone wants from me some tips that how can they start their journey, since as I said, that when I started, I didn't consider myself as an advocate. I wanted to do it for myself, and if anyone who has the similar experiences, I don't want them to go through like that. So sorry for that, I'm really sorry for that. My cat is here. So yeah, so the point I was talking about, anyone who wants to start their journey. So first I would say, identify your need and develop understanding of yourself, because that is when the self-awareness grow. That is when the motivation comes that, yes, I understand this is my needs and I want to be advocate. I want to do something. And for me, it was the greatest motivator. And then join a peer group, then join workshops where you can learn about mental health. And obviously, this, like I joined my community organization where I got my training, first aid training, and then this was my first step to join and do something about it. So I think you can start joining these communities, and there will be some activities to work on, who actually work on these things, and you will resonate with their concept of the learning. And obviously learn about your mental health, yourself, and keep learning these different narratives.
Yes.
And we are all different people. There are neurodiversity. Long ago, we didn't even know that how autism and ADHD and other neurodiverse people were looked down upon. Nowadays, you don't. We have now people are being aware, know about it, know the psychosocial barriers that actually hinder anyone. So how can we solve this problem, or at least to take some action from our end? So gather more perspectives. This is very, very important, that my story, my journey will not be similar to others. So how can we find a common ground, and how can we work it out?
Yes.
We are friends. We're not. Yes, we can help each other.
Thank
So
you,
then
Fahmida. Yep. Can you summarize just one line, please?
Okay, I will wrap it up. Sorry for taking so much time. And just I have some resources, if anyone can work. So you can see that BPD, Australian BPD Foundation, they have some beautiful, amazing resource for tips and tricks that how to advocate their lived experience journey. And you can find it. And if anyone wants, I can provide the links as well. And you can also scan the QR code. And there are also some self-advocacy tools. I think this will help people to gather some skills and to understand the privacy protection and how to share their stories safely. They can understand it. And also lived experience development governance education. It is an organization. They have some learning modules on lived experience advocacy and leadership, how they can help themselves. So yeah, this was my my presentation. I'm really sorry I've taken a long time, and thank you. And don't forget to be kind to yourself and to others as well. Thank you. Thank you.
Thank you, Fahmida. That's amazing. And you can share the resources to the chat box, or some shared information to the group later. So then we can move to the next speaker, which is Brian Henderson. So he's a seasoned leader with over 3 decades of experience in business and strong advocate for mental health and gender equality. So he's also a founder of Whole Business Wellness Limited. So he's dedicated to helping community and through storytelling, which is really relevant to our topic today, mindfulness and resilience building. So he's also gender advocate. So he received the 2017 American Chamber of Commerce Champion for the Advancement of Women. And you give a safe space for men to explore vulnerability. With your background in law and MBA from Cranfield University, you also accredited yoga teacher and mental health first aider. So without further ado, please, Brian, so you can, we will do the question and answer. So I would ask, this will apply to all of the speakers actually. What are the main challenges of making the because Fahmida talked about the lived experience advocacy, you Parth talk about the research, and I would ask the Brian specifically about, so what is the power of storytelling in mental health awareness, and how and what's the main challenges that apply to the storytelling in mental health awareness?
Yeah, thank you very much, Antu, and thank you everybody for joining us here this evening. Thank you to the 2 previous speakers for such wonderful talks. So I'm going to tell my story because this part is about storytelling. So my story started around 2018 when we started a very large restructuring in the company I was working with. I was the chief operating officer. I was on the executive board, leadership team. I was managing 2,000 people roughly. So it was a very big job, and it was a massive, massive global restructuring project, extremely stressful. It was due to last 3 years. I think they may have just finished it now, just 7 years later. Everybody wondering what was going on. And then we had some social unrest here in Hong Kong. You may have read about it in the papers, images of tear gas and people throwing bottles with petrol and stuff like that. And then we had COVID, and somewhere during all of that, my partner's health got really bad. She got really, really chronic asthma, and she was in hospital about 50 nights over the space of a year, and that really affected her physical and mental health, which was very stressful as well. And we bought a very expensive flat. I live in Hong Kong, and that's took most of our life savings. And then the last thing was that I got a new boss rather unexpectedly, and having been with my previous boss for a very long time. And so I was just really struggling. I was finding I was being irritable, I was being grumpy, I was crying at work, I was lacking motivation, I could not sleep more than about 2 hours a night, and I had chronic upset tummy. So that was my story. I was eventually diagnosed with depression and anxiety, and I was losing weight, and I had chronic gastritis and insomnia, of course. And after, so in the end, I had to quit my job. It was all just too much, and I just needed to take a break to recover. So I decided I would I wanted at some point, after about maybe 4 or 5 months, when I was feeling a lot better, and I set up my company, and I had some great business partners who really supported me, that I wanted to tell my story. And my way of doing that is probably not the way everybody would do it, but I chose to write it on LinkedIn. And actually, this was the first time even my family members heard my story, because I had so much shame about it that I didn't even really tell them the full story. But I got, I can't remember how many, like tens of thousands of people saw my post. I had hundreds and hundreds of comments. So you can imagine that was quite cathartic. I just got a wealth of support. There was no critical comment, no, or you're a loser or any of that stuff. Nothing stigmatizing at all. Just lots and lots and lots of support from people I actually maybe I didn't even know, or others just saying, "I'm so glad to hear this, because I can see we're like like Fahmida said, we're in this together. I've had similar experiences." And I found it very helpful to come to terms with what had happened to me, because as I was going through that experience from 2018 through to 2020, 21, it was very, very confusing. I actually didn't know what was happening. I even went to a lecture about anxiety and depression symptoms. I concluded I had them all, and I still just carried on working and didn't go to the doctor. Kind of crazy. And it just shows how confusing the whole thing was. So telling the story helped me to come to some sort of understanding of that story. So it did feel like a relief to tell it, just to get it out there and say, okay, it is what it is, and you can make of it what you want. But this is my story. And of course, like all good stories, you have to tell the happy ending. And at that time, I was in a good place, and I was able to say that I've been through some stuff, but I have recovered. I found my way forward, and that was really helpful. The next part I wanted to talk about is how to get started, and what are some of the barriers in storytelling. So for me, there was definitely a lot of shame. So I didn't want to even speak to my mum on FaceTime. I just let my partner speak to my mum, because mums can see how you're doing straight away. I didn't want my mum to see that. So she was as surprised as anybody else, really, when I finally wrote my story on LinkedIn. She's one of my biggest followers on LinkedIn, by the way, despite being 85 years old. Super proud of my mum. So that's a barrier that a lot of people have. You may find that you don't know what to say, like how much should I disclose? Should I write it? Should I tell it? Should I just speak to people? How do I do that? And you might not have the right language, and you might not feel like you're ready. So I have one very good friend called Benita Chick, and Benita has seen my story, and we were having coffee one day, and she said, right, I got a story I want to share. And I thought, oh, interesting. She said, but I'm not too sure if I really can, or if I really want to, if I'm ready to. I said, okay, why? She said, well, and she also was worried like what her mum would think. And I said, oh, well, have you spoken to your mum? And she said, no. But so I kind of coached her through it, and then she did have a chat with her mum, and her mum said, no, just go for it. And so she also chose to write her story on LinkedIn. And it was a very touching story. So, you know, you've got to be ready. You've got to have the support of your close ones, I think, was probably a better approach than I took. So speaking to your mum beforehand was probably smarter than the approach I took. But, you know, it helped us both. And she had the same reaction as me. Lots of people really very, very supportive of that part of her experience. And I guess the thing is, when you're telling these stories, to remember that this is only part of your experience, and you have this whole rich life experience of other things that you've done and achieved over time. And in terms of, you know, kind of safely telling your story, you don't have to tell everything. It's very helpful to be clear what you actually want people to know and what you maybe don't want them to know. And there are parts of my story I've never told anybody, and maybe never will. So you got to also then see, can I make it relatable, so people can understand? I think particularly with mental health issues, if you haven't experienced it, it is pretty hard to understand. And there's so much, you know, misinformation and stigma and all sorts of, you know, stories and beliefs around mental health. And it varies depending on your culture and which part of the world you're based in. So how do you make it relatable so people can understand, oh, that's what it is. It's not actually what I thought it was. It's actually something completely different, and I can really understand your experience. And then it helps, I think, also to be clear what you are trying to achieve for yourself and for others. So for me, it was just trying to get kind of straight in my own head. I've always been a writer. I just like writing. I started life as a lawyer, and as a lawyer, you do a lot of writing and communicating in written format. So for me, I find writing it quite helpful. Maybe you do journaling, it's a similar thing. But some people tell their stories, you know, orally. But for me, telling the story helped me clear my head in terms of, you know, what was happened, and helped me to, in a way, destigmatize myself. You know, it's not just a story, it's something that happened, and it could happen to anybody. And in fact, I'm getting people acknowledging that, in fact, something like that did happen to them. And of course, I think Fahmida covered the benefits to other people. They see themselves in your story and they think, wow, okay, that makes sense to me as well. But, you know, the fact that Brian has made sense of his story actually helps me to understand my own story. And then another thing is to anticipate the reaction. So, you know, I was very blessed that I had such a positive reaction from everybody, like friends, family, and complete strangers. But sometimes you will find there will be trolls out there who just maybe shoot you down. I posted on LinkedIn deliberately. If I posted on Facebook or Twitter or, you know, Insta or something, maybe I would have got a few of that negative reactions. So choose your medium carefully. And make sure you know how your story is going to give people hope. So those are just some pieces of advice.
Yeah.
I'm actually going to share my screen just for a sec, if that's okay, just to show you how I told my story. So this is my first post on LinkedIn, and I used the "This Is Me" hashtag, which is I think now a fairly global campaign of raising awareness through storytelling. So actually very short. When I reread this earlier this evening, I was thinking, wow, that was really short, but there was a lot of info there. And a nice smiley photo, you know, showing the hope and the recovery with my lovely, beautiful pet and my partner. That was my story. I then had a friend called Angela, as you can see here. She is a journalist, and she heard my story through a friend, who's her husband, is a friend of mine. And she said, Brian, I really want to interview you and write your story. And so the South China Morning Post is our biggest English language newspaper here in Hong Kong, widely read actually across the region. And I said a professional photographer, as you can see there.
Yeah, that's nice.
She told the story beautifully. Yeah, exactly. And then more recently, I did a podcast, and I've done actually a number of podcasts over the years. I find those very helpful as a different format. I was just sharing the podcast through another LinkedIn post, but you can see it's actually on YouTube, this one. So, and then the final one I wanted to share is Benita's story. So Benita very kindly referenced my support in her storytelling journey. And as you can see, what I found fascinating about her story is, like in the first line, she admits that she came out as a lesbian actually when she was a teenager many, many years ago. But coming out with her bipolar, she found that much more difficult, much more challenging. And I think that is largely down to the hugely stigmatized culture here in Hong Kong. And the reason she got to a place where she felt she could tell it was because she also has her own company, and her own company is like really successful. She's pretty well established. I guess she's more now mid-life, mid-career. She's got probably never going to be in the mainstream corporate world. So she's not too concerned actually what people think. So she has that self-confidence of like, I know who I am, and if other people don't like it, that's their problem, not my problem. So she's just got herself in a very good place to tell her story. And she even talks here in this paragraph down here about the hesitation she had about coming out, even as a DNI advocate and diversity and intersectionality advocate. And also with a beautiful photo. Makes all the difference when you're telling your story.
That's quite.
So yeah, so that's all I wanted to share. Thank you.
Thank you, Brian. So yeah, my next question was asking about the guidance how to telling our story. So I think you already covered all of the answers. I think you're right about pointing out that we should choose our safe platform to share, which is, I'm agree with you that LinkedIn is quite a safe environment because you'll find professional that really in the area, so they will give a lot of support. So thank you, Brian. So we will continue on our discussion, which is back to Parth and Fahmida to answer the first question, which is what the main challenges in your area and how to overcome that. Maybe a short answers. Then we will continue on the question on the chat box that already arrived. Thank you.
Right. I think I'm just going to add this to the question that Hasbee also put in the chat because they're very similar. Is that there are a lot of barriers that come in are that, a lot of people don't understand the extent of disclosure when you're talking about lived experience. What even Brian spoke about was that as a trauma survivor, I don't owe anyone the extent of what happened to me or what my trauma was. Just the fact that I'm a trauma survivor and I'm talking about it within this space is sometimes not enough. So when people come to me and they say, okay, you have to be explicit about it. You have to tell us what happened, at what age, because that informs our research. It's a very bad practice because that's, again, a very strong power hierarchy. So at that age, I'm 24 years old, and that stuff like that has been happening for a while now, where in research or in professional settings, even though now I'm a trained trauma therapist myself, still within medical spaces when I'm in therapy, there's an expectation to disclose, which is not important at all, and which I think I'm borrowing from Brian's part also, that I don't owe anyone that information. And as lived experience experts, we don't owe anyone that space either. So one of the strongest barriers has been that, to be taken seriously in these spaces if you don't want to disclose your experiences. What about you, Fahmida?
Yes, I totally agree with you. And I have also received a question where it's asked that how did it actually influence my advocacy. To be honest, I can do what is in my capacity, and I don't want to push beyond that. And since I am also learning, I don't want to do anything that I think it would be better for others, but eventually it will harm. So we cannot do anything that actually is a harm in disguise. So what I can do as also by training, I'm a public health researcher. I'm really focusing on mental health research. And what I can do, what are the trainings and experience I've gathered, I can share support. I can provide support if they want support from me. And obviously, if I see that people may need help, I think that they can, if they can join and talk to someone, they can get some help. If I can identify, I just share my own experience and talk it out, just as a peer, as a person, as a friend. So that's all I want to do. I think even the people do not think that it may be important. Sometimes we just discard it, but it is as simple as that, because that is when, if the support is given at the beginning, we might prevent a big problem like suicide or something like that. So that's I take from my experience, actually. Yeah.
So Fahmida, basically your experience personal in mental health challenges, it's influenced your advocacy effort within the context of Bangladesh? That's exact question.
That was my question. That was my answer, that I
Okay.
can do only what is in my capacity. But at the same time, another question probably has been asked, that what are the challenges where when like when incorporating with vulnerable people. If I'm being very honest, I come from a lower middle income country where poverty, where social injustice is the biggest problem. When it comes to the part of mental health, nobody actually prioritizes that. Nobody actually, even though they are in trauma, nobody say that I am in trauma, because they are actually dealing with daily life. And it needs, we advocate, what we are calling ourselves advocate, it's our probably responsibility, or that through our work, we create the awareness that if you can identify that you are also in trauma, we identified ours, and if you can resonate with us, this might help you. This is how you can learn. This is how you can go as well, if you think so. So
Okay,
yeah,
thank
I
you.
think this strong resistance there. So that is the biggest problem.
Thank
Yeah.
you, Fahmida. And yeah, it takes a lot of strength to be an advocate. Yeah, we have one raised hand on the audience. Shreyas, please, you can grab the mic if you so. Yes.
Yes. Hi, may I ask a question?
Yes, where you from?
Yes. Hi, I'm Shreyas. I'm from Delhi.
Okay.
I am a policy researcher with a mental health policy researcher, and I had a question for Parth with respect to what they said in the beginning of the webinar. They said that the biomedical model is different, where doctors and people who are medical professionals are people who are leading researchers. But I was wondering if bringing forth people lived experience in the forefront, is that enough? I mean, bringing forth lived experience in research is enough, in the sense we often see that even if we do bring people with lived experience in research, they do tend to be decoration pieces rather than and the people who are doctors or people who have had education do tend to be principal investigators or leaders in a certain project. And this discourse also extends to queerness in research. So I was wondering if you had any thoughts on this.
Yes, please, Parth, you can answer. And
Yep.
and Brian and Fahmida, you can also add something. Yeah, it's
Yep.
about tokenism in research. And okay, please do, Parth.
No, that's a fantastic question, Shreyas. And I would like thanks for bringing that up, because tokenism does happen, and it's very often right now, because even with the Lancet Commission saying that lived experience is a very integral part of research, you see a lot of people tokenizing people with lived experience within that format. So that power hierarchy will always be there. But I think instead of looking at it as a push and pull model that lived experience researchers need to be only them and no other people need to be principal investigators, or experts by training need to be more and lived experience needs to be token. I think you need to understand how a co-design approach would say a community advisory board, if not within the team who is doing the principal research, the investigators, they can be people who are doctors. We're not saying that that's wrong in any given capacity, but make sure that the community advisory board, one, has diversity in them for lived experience, and second, at the same time, is active throughout the process. So it's not just when the concept of research came in and they've got the reviews done and they're already in the process of collecting data, that's when they get in a community advisory board and see, this is what we have, now we want to inputs in this. Instead of doing that approach, which can also risk tokenization, is to say, okay, we're thinking of a concept, we now want to assemble a community advisory board with queerness, with disability, with lived experience for mental health, and be part of that process from the beginning and the get-go itself. So no research questions are also decided until a community advisory board is in place. That is essentially saying that lived experience experts are involved from the forefront and are not tokenized. And second would be compensation. A lot of the work that even I have done in the past is as a lived experience expert or within my space as a youth leader also has gone non-compensated. So to say that, you're bringing in people, don't just bring them for, okay, this is a token, but compensate them fairly for the experience, consider them experts by experience, and at the same time, keep them active to that process. I hope that answers your question.
Yeah. Brian, you want to add something?
No, not really. I mean, I just did another post actually this week, and the first line of that was, is it possible to be an expert by lived experience in Hong Kong? Which is a rhetorical question because the answer is clearly no. People don't even understand what that means here, unfortunately.
Yeah, it's still a big challenges, and everyone, we still advocating on it in everywhere because they're still initiating of the lived experience, meaningful engagement. Anyway, so let's get to the raised hand. So we have Jacqueline, please. You can grab the mic.
Hello, everyone. This is Jacqueline. I'm a caseworker where I'm working, and I've found it very interesting when you try to share your experience, a bit of your experience, depending on what case you have, how tremendous it changes one's expectations and how it changes one's frustrations. Because right now where I am, I'm working in Toronto, and I'm working with an organization called Toronto People with AIDS Foundation, but I'm receiving lots of people who have mental health challenges. And sometimes they may come when you cannot visibly see that there might be mental health challenges. But then as you talk, as you continue talking, and as the person shares, you realize the person you're dealing with has some mental health challenges. And then depending on the case they are presenting, you will find a way of bringing in like a few examples, especially when they are on yourself, and then you bring it out and show how you have overcome the challenge this person is going through. There's a way that it turns the button, and they look at things differently. For example, there's someone who came last year, and from the time he entered the building, everybody saw there was a problem. So he came like he was hiding, he was kind of in isolation, but he still wanted to talk to someone. And this person was like hiding in his hair. He has a lot of hair. So he was hiding his face in his hair so that no one identifies him. And he kept saying he only wants to talk to me because he had been my friend because of how I had talked to him previously, which he thought no one else would understand him. But after talking to him, he developed that kind of security because of what we talked about, how I expressed myself, and a few examples I gave to him. So this time he came when he had issues when he wanted to commit suicide. Mm-hmm. But before he committed suicide, he said he wants to share he wants to say bye to me because he took me as a special person in his life. But from the physical experience, from the physical look, everybody could see there is a problem because even the staff stayed around near my office to see in case of anything to help me get me out of trouble because they thought he had come to cause trouble. But the problem was he really wanted to commit suicide, and he had come to say bye to me because he wanted to commit suicide. So I had to close the door and I had to talk to him like calmly. I had to ask him a few questions using my professional skills that I have. Then later I was kind of, after hearing him out, I was forced to share my whole life experience from how I was born to what I have gone through, how I got into depression in 2012. Throughout 2012 up to 2016, I was going through mental health. I even went to a dose of, I began from 10 milligrams. The medicine I was taking, I forgot the medicine. I began from 10 milligrams, but by 2016, I started in 2012, but by 2016, I was at 45 milligrams, meaning I had gone far. My mental health was getting worse. But later, a few things happened and I was able to recover. Now I'm no longer on medication. So I explained to him all that I went through, and it's like I reset all his life. Because after 3 weeks, he came with a plant. It was a beautiful plant, and said, Jackie, this is a plant of life because you recovered my life. Even before leaving my office, he said, today, I don't think I've talked to you. I've talked to someone else who is in you.
Okay.
So you see how sharing an experience sometimes turns around someone's life and makes a very different decision compared to what they wanted to do before. So it is not a must that everybody has to share their experiences, but it depends on the case that comes to you.
Yes.
That sometimes you're forced to share your experience in order to empower the person that is before you.
We agree, Jacqueline. Thank you very much for taking that action, so that it proved that your story can inspire and give some strength to other people that within the trouble. So now we know the power of storytelling among us. So thank you, Hasbi, Jacqueline, because we have really ran out of time. We only a few minutes left. So Hasbi, could you please jump into your questions, and anyone from the speaker could answer it with the short question. Then we have some closing statement from each, because we at the end of the time. So I think we can do that. Yes,
Sure, no
Hasbi,
problem.
please do.
Okay, now this is not really a question, but just
Okay.
I want to pick up from what Parth and you mentioned earlier. Just for context, I'll keep this very short. Just for context, I'm on the clinical practices guideline review committee for my country's health ministry, and I'm not paid. I'm not paid. I'm part of the oversight, and I'm not paid. I'm expected to come for 3 meetings a year. And it's difficult, which is why I brought up the question to Parth earlier. How do you navigate these existing power structures? But having said that, I would rather have a say in how the guidelines are formed and not be paid, rather than being kept outside and not having a say. So it is sometimes a very difficult decision for advocates to make. Yes, I deserve to be paid. But if I am not involved in this process, then there is no lived experience involved in the framing of those guidelines. And I hope everyone doesn't have to make this decision, but it is something that I guess, have to decide on a regular basis. So I want to thank Parth and you for actually bringing that up, because it's very important for advocates to begin to actually decide, where do I draw the line? So thank you very much.
Thank you, Hasbi, for contributing some outlining the presentations. I welcome all the speakers to have 1 or 2 lines closing statement. Then we will finish this event. Okay, please do. Parth, I think you first.
First, I would like to thank you, Anto. Thank you so much for doing this and moderating this, and also Yana for giving the opportunity. One of the things I would like to close this discussion would be by saying that, for the longest time, we weren't even considered to be at the same level as people without mental health conditions. We looked at people with deficits in them. So we fought very hard to be considered people of value, people of a lot of potential. And now we're finally at a space where places like the peer network, places like what work we are doing with our own countries as well, where we can be considered experts by experience. So there is a lot more to do. There's fair compensation, there is representation, there is voices, lack of no tokenization. There's a long road ahead, but it's also important for us to notice how far we've come along right now. And also there's a very strong resistance that you have to do to existing power structures as a person with a lived experience when you're advocating. So do rely on your community support for that as well.
Okay, thank you, Parth. Fahmida, 1 line of statement.
Yes, thank you, everyone. First, at the beginning, I'm thanking everyone. It was a wonderful discussion, and it's needed. And obviously, as Parth said, that we absolutely have a lot more to do, a lot more resistance we have to go against. But I believe that the journey we have started, if we keep our integrity, if we keep working together, we can do something. And some days, or sooner or later, some days, we will not have to see that all these things are doing we have to be voluntary or something like that. It will be paid or just remunerated, it will be acknowledged. So yes, And it's not only for only this way, this thing that we are doing it for payment, not like that. But obviously, in society, there should be a level of acceptance and acknowledgement of it, because we
Okay.
are definitely experienced by experience. Yeah, experts by experience. Yeah. Thank you.
Totally agree, Fahmida. Brian, last statement that
Okay, very briefly. Yeah, so your story is very powerful, both for you and for other people. But it is your story, and you should tell it in your own way, at your own time, and only when you're ready. So a very
Amazing.
simple message for me. Thank you.
Thank you. Thank you everyone for joining this really burning up discussion. Really great to be here, join this event. And let us continue to amplify these voices, support one another, work towards the future where mental health is still destigmatized, understood, and prioritized. So thank you for joining us in these important conversations. Have a good day for you all. And we are finishing this event. Thank you. Global Mental Health.
Bye-bye, everyone. Bye.
Bye.
Thank